Hey, this is Sarah with RegisteredNurseRN.com, and today I'm going to show you how to start an IV. In my previous videos, I've showed you how to prepare your IV kit and how to find a vein on a patient and the different size of IV gauge needles. So if you haven't watched those, you probably want to watch those videos before you actually watch this. So today we have Miss Smith, and she's our mannequin, and we're going to start an IV on her. Before you ever start an IV, you want to get your supplies. Here's what I have for my supplies. We have a 22 IV gauge needle, an extension tubing that will connect to the cannula of the IV. You can use a cap, it's whatever your preference is. A saline flush to prime the line and to ensure that our IV is patent once we get it. And an IV start kit that contains our tourniquet, our cleaning supplies, our tape, everything, and of course a pair of gloves. After you gather your supplies, go to your patient and explain to them what you'll be doing. Explain what the IV will be used for, how it's inserted, the pain they're going to feel, a little bit of pain, and just talk to them and let them share their concerns with you, because a lot of patients, they hate starting an IV. Where I work, we get outpatients, and the very first thing we have to do is start an IV. And they say, if I knew that I was getting an IV, I probably wouldn't even came for the test. So people really hate IVs. So what I'm going to do first is I'm going to get my tubing set up, and I'm going to put the tourniquet on the patient and look for a vein. So your kit comes with your tourniquet. I have a video on how to put a tourniquet on a patient before you start an IV or draw blood. There's a trick to that. So what you'll want to do is, I like to put my tourniquet above the bend of the arm and just tie that with a quick release. And I like to have the patient sort of put their arm down so gravity will have the blood pool in the extremities, and have the patient pump the fist. Miss Smith can't pump her fist because she's a mannequin. But in a real person, when that happens, the veins will engorge and you'll be able to find them. Typically where I like to look in the AC region or the hand. People like to do the forearm. It's really your preference, what you've got good at over the years. So here's the AC area. In the hand, I like Miss Smith's hand vein, so we're going to go with that. And while that vein is getting nice and engorged, that's going to help you. Whenever a vein is nice and puffy, that decreases your chances of missing the vein, because a lot of times the veins like to go flat and you really just miss them and you have to try again. So while our vein's getting nice and engorged, we're going to get our kit prepped and get our extension tubing flushed. So I've done hand hygiene, so I'm going to put my gloves on. And always be careful while you're messing with your supplies, because you don't want to contaminate it, because this is going in the bloodstream and you don't want it to introduce any germs into the blood. So what I like to do first is I like to prime my extension tubing or my cap just to get the air out of the extension tubing. So I'm going to get the tubing out and get my saline flush. These are pre-filled flushes. I love it because I remember a long time ago you had to draw up your own saline. So I love pre-filled saline flushes. Saline flush has a bubble in it. You have to prime it and get the bubble out. You don't want to inject that air in the patient. So what you do is you just take the plunger and you just push it up and have a little bit of saline come out. You're going to screw this onto your extension tubing. Extension tubings vary by hospital settings. So what I'm going to do is I'm just going to screw that in on the side, and I'm going to flush my tubing just to get any air out, and it will leak a little bit. That's good. That means that you're flushing the tubing. I'm going to keep my saline screwed onto this extension tubing and this cap on just to keep it clean, because whenever you actually start your IV, you don't want to be fumbling, trying to screw your saline on while you're holding an IV down to prevent blood from coming out. So I just take that and I just put that back into the little packaging. Next, what I like to do is I like to get my tape ready. So take your tape out, and I peel, I don't know, about 4 to 5 inches off, and I like to tear it in half because I use these two pieces to secure the IV line in place. People do it differently. This is just how I do it. And I like to just set that aside because I know I'll be using that. Next, and gloves and tape do not go together. There we go. Okay. Next, I'm going to clean the site. In your kit, this kit came with betadine and alcohol prep. A lot of the other kits are coming with chlorhexidine, so like a really strong alcohol that kills germs, but this kit did not come with it. If your kit does come with betadine, make sure your patient isn't allergic. So I'm going to take this alcohol and I'm going to clean the site. I'm going to clean it about 10 to 15 seconds in a circular motion, really killing any germs or any normal flora that's on her skin, because I don't want to introduce that into the bloodstream whenever I go to insert the IV. So we're getting that nice and clean. And then you let it completely dry. Don't blow on it, because when you blow on it, you're going to put your germs on it. I've seen people do that. Don't blow on it. Just let it air dry itself. And be getting your IV ready. This is a 22 gauge. Miss Smith is just going to be having some basic testing, so she doesn't need an 18 gauge or a 20 gauge. She won't be getting blood, so we're just going to do a basic 22. So it's always good to test what size IV you need to start on your patient, because patients do not like to be stuck with an IV, and then you come and tell them, oh, the doctor's ordered a CT with P protocol, you need an 18 gauge. So always try to do the right gauge needle. So what we're going to do, I like, on these plastic cannulas, again, your hospital will vary on what they have, but I like to just move that around, because sometimes there's like this little glue on it, and when you go to advance, it won't advance. So just sort of break that seal a little bit. Okay, so we're going to start our IV. So we have our vein there. It's good for the patient to make a fist sometimes to prevent those hand veins from rolling, because the hand veins like to roll. So have your patient make a fist if it is a roller. And I see the vein right there, so I'm just going to go in. Okay. Now, once you go in, you ask yourself, how do I know I'm in the vein? Look in this little chamber right here. In this chamber, you will see blood start to collect. That is a great sign. That means that you have hit the vein. Sometimes you can see the blood come up through the cannula, and that means you've hit the vein. So once that happens, what you need to do is just advance just a little bit more, just a little push. Because I have noticed I hit the vein, and when I hit the vein, I try to advance the cannula like that, and it won't advance even though I'm in the vein. Typically what you do, if you advance, it puts the needle a little bit better in the vein, because normally the needle is just right barely in the vein, and when you try to put the cannula in, it doesn't go. So just insert just a little bit more and then slide your cannula in. You can use this tip right here to slide it in, and this plastic cannula is sliding off of your needle and it's going in the vein, and your needle is going to stay with you. Now after you do that, see this button? That is a safety. That's to protect you. Hit this, and your needle goes straight into this chamber, protects you from any sticks, and you put this in your sharp spots. Okay, we have that. Normally blood will start gushing out, so you need to just hold above where the cannula is like that with your thumb, and it'll prevent the blood from coming out. I remember whenever I was first starting IVs, I would have a huge mess because I wouldn't do that. So always put your hand right there, and while you're doing that, go over to your extension tubing and take the cap off that and just screw into this part right here. Always screw this very snugly, because a lot of times I've been giving medications because I work in a testing area and the IV wasn't screwed on very well, and we have to give radioactive isotope. And from where the person who started the IV didn't screw it on well, it would leak. So always make sure you have that screwed on well. And we're going to flush with a saline flush in the IV. And what you're looking for is you're looking for it to puff up around the site. If it starts to puff up, that's a bad sign. That means that your IV is infiltrated and the saline is going in the tissues and not in the vein. Take it out and do a new IV. Or if it's burning the patient, because sometimes the IV will be infiltrated and you won't see it puffing up, and it'll be infiltrated even though you don't see it because the patient's telling you, oh, that's burning really bad because the saline's in there. Think about when you get salt in your eyes, it burns. So if saline gets in the tissues, it's going to burn. Now, it's normal for the patient to say, ooh, it feels like something's dripping down my arm, or it's cold, or I taste it or I smell it. That's a great sign. That means it's in the vein. So we flushed it and it's in there. So what we're going to do is we're just going to take this saline off and we're going to tape our IV down. That is another important part. You always want to tape your IV down good, because I remember one time I worked really hard in getting an IV and I didn't tape it down right, and the patient got up to go use the bathroom and lost their IV, and I had to do another one. So I like to take my tape and put it underneath this part, the cannula part. And tape and gloves do not go together. I'm just going to tape it down about right there first so I can secure it. And I'm going to take this other piece of tape that I tore and just put it underneath this. And I like to just lace it around it. These gloves and tape are so sticky. Okay, then I am going to put the Tegaderm on it. And we'll just tape it down a little bit more. And always clamp this part off so blood won't pool in there. And you have to really peel this tape back so it'll stick. There we go. And sometimes it's really good to secure it with some Tegaderm. My kit didn't come with Tegaderm for some reason, so we won't have that, but always put your Tegaderm around that and clamp your thing and put your date and time on it so the oncoming nurses or anyone who takes the patient will know when you started it, what gauge it is, and I know in the computer we can chart it. So always pop your tourniquet off after you're done. And we're done. So that's how you start an IV on a patient. And if you have any questions or anything, be sure to visit my website, registerednursern.com, because that's where you can find all the articles you need about nursing skills and talk about nursing. We have a forum where you can connect with others. So thank you so much for watching. If you like this video, please share it with others.